What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
How do you get a barber to cross the road? Just yell, "Comb over here." What did the Kaiser roll say to the bratwurst? Gluten Tag.
It's backwards day today.
A grasshopper hops into a bar. The bartender says, "I'm going to serve you a drink named after you." The grasshopper responds, "You have a drink named Steve?"
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, traditional Chinese medicine provider. Gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott. Hey, Dr. Steve. And my partner in all things, Tacey. Hello, Tacey.
Hello.
And P.A. Lydia. Hello, P.A. Lydia.
Hey, hey.
We're going to embarrass you later. This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at Lady Diagnosis. Well, okay. Or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Thank you. Thank you, Sherwin Sleeves, for the delightful opening.
Yes, thank you.
Check out stuff.drsteve.com for all your Amazon needs. 'Tis the season for shopping online. And you can get everything at stuff.drsteve.com. Just go straight through to Amazon or scroll down and see all the cool crap we have on there, including the roadie, robotic. What? What's that face? The roadie robotic guitar tuner. If you know someone that has a bass guitar or a regular guitar or a mandolin, you did your mandolin on there. There's a bunch of different stringed instruments. It will tune it for you. You just attach it to the peg, and then you pluck the string, and it winds it for you. Have you never seen it go?
Crazy.
I'll show it to you in a minute.
Yeah, that's cool.
Mine's here somewhere. I don't know where it is. Scott's got it. And then tweakedaudio.com, offer code FLUID for the best earbuds for the price on the market, and 33% off if you use the offer code FLUID. Check out Dr. Scott's website at simplyherbals.net. That makes good stocking stuffers, a little fatigue reprieve or some peppermint nasal spray.
Yes, sir.
And then Chasey and I have a show on Patreon called, Weird Medicine. I guess the special edition at patreon.com/Weird Medicine. But we also do a type of episode called The Exam Room, where we have celebrities calling in and asking us questions. And boy, do we have a whale this week. We've got the biggest of the big, if he shows up. We've got the biggest guest that we've ever had.
Big if he shows up.
Yeah, I think he will. I think he will. And if he doesn't, we'll just keep teasing it until he does. But this is a big one. You're not going to want to miss this one. And he already gave me his list of questions he's going to ask, and they are doozies. So he's very naughty. Put it that way. Yes, he's a very naughty young man. So check us out, patreon.com/Weird Medicine. And if you want me to say fluid to your mama for the holidays, be they Christmas or be it Kwanzaa or be it Hanukkah or any other holiday.
For the rest of us.
Yeah, Festivus. Go to cameo.com/Weird Medicine. And really, over the weekend, I dropped the price to $3.99 just so I could do a bunch of them, and did a bunch of them. It was fun. And but
so
it's
we
still...
made like $15 this weekend.
Yeah. Ooh.
Hey, when you're making $0, $15 is a lot of money.
Yeah, I just do it for the fun of it. But I did go back to, it's like $9 or something, which means that on the iOS app, it's $9.99. So I didn't want it to be any more than $10. So I have to ratchet it down to $9, which they take a bunch. So look, I'm not making anything out of it. I just do it for the goof. It's just a goof. All right, and that's about it. You got anything else? All right, very good. So anyone who's been listening for a while knows that PA Lydia forgot to grow boobs in school, and she did everything else, got straight A's and stuff, but that was one of the things she forgot to do. And she is considering, after having a kid and now kicking a guy to the curb, getting breast augmentation. And we've had different people on. We had Lady Diagnosis on. And we were going to have my other friend who had the Asia syndrome, but we talked about it instead. But today, as promised, we have Ebony Mystique. And you can follow her on Instagram at the official Ebony Mystique, and on Twitter at Ebony Mystique 1. She has her own podcast, Ebony Mystique TV. You can enjoy it on YouTube. And she started her career being a nurse. And then she is now an adult movie actress and celebrity fashion designer. And Ebony Mystique, thanks for being on the show.
Thank you.
Thank you.
Thank you for having me.
Well,
I appreciate you guys today.
It is a true pleasure. One of the things, I'm looking at a photograph of you, and by the way, you are quite lovely and delightful. And Lainey Spicer, your publicist, sent me your measurements. It said you're 36 triple D. Now, I must be just terrible at estimating this. I would have guessed you were much larger than that. So you must be small in stature. I'm surprised. I would have guessed like 42G or something. But I'm a guy. What do I know?
Close enough. It's funny, when I first decided to do the enhancement, I didn't want to go so big, but actually my plastic surgeon recommended that if you're here, you might as well go big or go home. So we went ahead and put the triple Ds in. Mm-hmm.
Yeah, sure. I've seen that on some of these plastic surgery shows, and I've seen it in real life. I mean, I actually am a practicing physician in real life, and have had some experience with this, where women will get a one size and then decide that they want to go bigger, and they keep getting bigger and bigger, and that actually causes some problems. So you should probably go for the size that you want right off the bat.
That's good to know because my third time was the charm. That's when I went this big. So, wow, I wish I knew you then, Dr.
Well, and you were a nurse before, right? I mean, that's what I read that in your bio. I actually did not know that before. So how long were you a practicing nurse?
Absolutely. Yeah, I was a critical care nurse for about 13 years, and then I decided my last year in the field to do advice nursing, and then here we are.
Wow. Yeah, I bet those guys saw you coming in the ICU and they either got better or they just died. Had a heart attack. Well, listen.
Of course, these triple Ds wouldn't work in that field.
No, they would work just fine. But anyway, so PA Lydia, she's a physician assistant, and she. Did I say it at the beginning?
Yeah, forgot to grow boobs.
Yeah,
Thank
yes,
you.
yeah, right.
Yes.
She loves it when I say that, or she never learned how. And so she's thinking about augmentation, and we had some folks on earlier. A lady diagnosis was on, and then we had another lady that was going to be on, and that she actually didn't show up, but we talked about the complications that she had. And Lydia's got some questions for you. So I wanted to kind of go from small to medium to, perfect.
The eye of the beholder.
That's right. So anyway, take it away, PA.
Yeah. Hello, Miss Ebony.
Hello, how are you?
I'm great. It's so nice to speak with you. So I think the big question I have from being for 33 years now in the small boob club is some of the negatives that I should think about and figure out whether they're worth it or not. So my first question to you is, do you have the back pain that people talk about, or do you just work out and prevent it? What's your take on that?
You went out. I'm sorry, I didn't get the question.
She was asking about back pain.
Yeah, do you have back pain from your large breasts?
Oh, back pain. Actually, they're really comfortable, and initially, just with the body trying to get used to a foreign object and it being so big, I think I did experience a little pain, but now I'm doing great.
Okay. Can I ask you if you still have your nipple sensation?
I do. I have my nipple sensation. I didn't lose that at all. And, the main thing is the support. Like, when you go this big, you should, wear some type of supportive bra or something like that, for sure.
Okay. And when they did it, did they go, under your pectoralis muscle, or did you go on top? How did that work out?
Yeah, they went right through the areola, and then they kind of closed it back up through there, and I was able to get a really good, nice shape afterwards. So
no kidding.
I'm really happy.
Okay.
I just followed the surgeon's guidelines.
That's cool. So they made the incision around your areola and put it all in.
Yeah.
Neat. Okay. How long was your recovery? How long were you unable to lift stuff? I have a 2-year-old.
I would say about 1 to 2 weeks was kind of hard. The first 2 days are the worst, and then it gets better after that. But after 2 weeks, you get back to sort of activity, just not too strenuous. They kind of recommend 4 weeks, so it's best to kind of see how your body goes and just really take your time and do as the doctor says, the surgeon. Yeah.
Okay.
Now ask her the important stuff. What about unwanted attention from men? And do you walk around hiding your body when you're in public, or do you accentuate it and let people go? Hell, I paid for this. Take a look.
Stretch your stuff.
Yeah, do you stretch your stuff?
I don't get much negative attention. I mean, I already do mainstream adult films, so but outside I'm more modest. I think the attention that I get either way is going to be somewhat sexual because of my job, but. Yeah, everything's been I've been pretty well respected out in the community with people. I kind of dress more modestly though out when I'm out and about.
Yeah.
Okay.
I don't really want the negative attention. Yeah.
Yeah. I don't really like a lot of attention.
Me neither.
You are a liar, actress. Go the out.
Uh-oh. Ebony, are you gone? Yeah.
Yeah, you guys and girls. Well, I will be back. Dr. Steve and Weird Medicine is going to have me back on Skype so you actually can see these triple D boobs.
Yes.
And kind of get a face. Get a face to this voice. I'll be back soon. I'm actually shooting for you guys today on my lovely fans and supporters for Browsers.
Okay, so
yeah.
So go ahead and get your plugs out, Mystique, and Ebony, and then we will definitely have you back because we are having some real technical issues with your connection.
Let's do it.
I know they can see you on Brazzers. Where they go to brazzers.com.
Yes, go to browsers.com to see my mainstream scenes. I'm an exclusive contract girl with them. And then, of course, you can follow me on Instagram, Ebony Mystique Official, or my Twitter is Ebony Mystique 1. And you get all the goodies there. I can't wait to talk to all of you guys.
Okay. Hey,
Okay.
we'll do this again. I'm sorry about the technical stuff,
on.
but have a wonderful shoot, break a leg, or whatever you say when you're going to do a scene.
Okay, thank you. And I'll be waiting for you soon so we can set up the site.
Okay, I'll talk.
Okay.
I'll
Thank
talk to
you.
Lainey about it. Okay, take care. Okay, bye bye. I know you're very uncomfortable with all of this, but we do have another person. I would like to have Ebony back on because she seems really cool.
Yeah.
And I was quite distracted looking at her promotional photograph.
I'm sure you were.
Because she's quite delightful.
He is the biggest boob man you've ever met in your whole life.
And it's not. I mean, look, I like the. And I haven't said this on the show in a long time because I've tried to be a little bit more whatever, but it's the tit to gut ratio. That's the thing, And we figured out one time, there's this thing called the golden mean. Have you ever heard of it?
No.
Okay, so it's a ratio. And the Greeks found that if you make buildings according to the golden ratio, which is 1.608 to 1, that they will have pleasing shape. And not only that, but the chambered nautilus has the area of the different chambers is in a ratio of 1.608 to 1. And you start seeing the golden mean everywhere. Sunflowers use the golden mean to make that sort of interesting pattern of the seeds and stuff. So you find the golden mean everywhere. So I said, well, that would be fun to see if the golden mean applied, to
the
human
women,
proportions.
Yeah.
So if you have so what's your waist size? Just make something up. It doesn't have to be real. Okay, let's
Teeny.
say teeny. But let's say it's 25 inches.
Shit,
okay.
I doubt that.
So
Yes.
then if the golden mean applied, then the chest size should be in that ratio of 1.608 to 1 and the waist as well. So let's figure out what somebody would be if they had a waist of 25 inches. Echo, what's 1.608 times 25?
1.608 times 25 is 40.2.
There you go.
By the
40,
way, you have
25, 40 is perfect.
40 on the waist. I mean, the hips, no thanks.
No, well, 40, 25, 30 something
Yeah.
would be perfect. So
36.
anyways, but
34.
so it's all about that ratio. You could be a tiny little person with 32 B's, but if you're a tiny, you've got a 21-inch waist, it's perfect. So I'm not all about just giant boobs. If you weigh 800 pounds and you've got boobs hanging down your ankles, that's not going to be
The lady we just had
necessarily-
on, her frame is so small.
Yes.
Yeah.
And that's why her breasts look so
That's why they look so big.
big.
Yeah,
yes.
yeah. I think if we saw her in real life, I didn't see how tall she is.
I mean, a triple D on me is
well, she's
nothing.
5'7". She's 5'7".
Okay, that's my height.
Yeah.
But her
Okay. Well, there you
frame,
go.
though, I mean, she's got.
Well, her frame and your frame are exactly the same.
yeah,
so
that's
what
exactly
you would look
what
like.
you'd look like if you went that big.
Google image Ebony Mystique. There you go.
Yeah, I got
Yeah,
her.
that's what you would look like.
Yeah.
Yeah, I think that
I'd
looks
look
like about the
exactly-
right size.
He would.
Yep.
Sounds great. That might not go quite that big, but
we'll
we'll
be
talk.
filing
We'll talk
for
further.
divorce.
Nothing scared Steve more than the consultation I had getting my breast reductions.
Yeah, that's not
Probably
a lie.
one of the worst days of his life.
Well, I wasn't, I thought you were perfect the way you were. But I did go in and I said, here's a picture of Katy Perry's tits. If you can do that.
That is an absolute lie.
What? No, I did. Yeah, I did. I brought
She's
in.
pretty large-breasted, isn't she?
Yeah, but they're smaller than what Tacey's were. I said, no, what are you talking about? I brought that in. I said, if you can do this, I'll be fine with it. I said that to the surgeon during that consultation.
I do not remember.
I'm glad he was concerned about your health and well-being.
No, I do not remember
so
a picture of Katy Perry.
She was
anywhere.
She was totally healthy.
I know.
I would
I
have
brought in
Katy
a picture
Perry boobs.
of Katy Perry and her boobs.
I
And
would
I
definitely
said, well, I'm not going to say it again. I mean, that's what I said to the guy. And he said, yeah, I can do that.
Cool.
He left a little extra.
That.
Now, the other fucking thing about that whole thing was, I got behind it. I wanted to do what you wanted to do. But what pissed me off is they told us to be there at 5 a.m. And so I get her there at 5. They take her back and they say, well, we'll let you know when we're done. So I read my book for a little bit and then I fell asleep. And then I woke up, read my book for a little bit, fell asleep. 9 a.m, they come out. And I'm like, okay, cool. And they go, oh, we're taking her back now. They hadn't even started. They just had you back in surgical holding for 4 frigging hours.
Yeah, he was.
That was annoying as
habitually
shit.
late. Yeah, I didn't know that when I scheduled him.
But what was cool was when you did have the arterial bleed in your boob New Year's
Holy
Eve,
crap.
and we're drunk AF, and she's got one breast is twice the size of the other one, and it's like rock hard like that.
That's crazy.
He came to the emergency room and took care of it. Now there's nothing more sexy than seeing your surgeon open up your wife's chest wall and scooping out
Clumps of blood.
clumps of currant jelly and then sewing it back up. That was awesome. But good God. What a night.
Yeah, that was a night.
And I'm talking about how bad it was for me. I mean, it's, she.
Tacey's like, oh.
Yeah, it was
something.
Slightly worse for Tacey, I
Yeah.
guess. But anyway.
But here we are.
Yeah. But
Yeah.
now you're perfect.
Yeah.
Could use another one. We'll talk about that later.
Yeah. We'll talk about that when I'm serving you papers. So, so we'll have her back on. And then there is a fourth person that wants to talk to you that had some issues with what Lady Diagnosis said about her augmentation, and she wanted to just be the voice of reason for you.
Okay.
And then we'll have her on, and then you decide. And then whenever you do it, we can have the big unveiling here on the show.
Yeah.
I mean, hell, you've done...
Just unveil it. Just show it.
Actually,
We'll see.
I know it seems weird, but most women that I know that have had breast augmentation, they're like, yeah, you want to see them? It's crazy. And I'm like, well, sure.
Okay, if you force
The thought of that mortifies me slightly.
Nah, I'm good. No, you don't have to show us anything.
A friend of mine.
I'll show Tacey.
in a store after my last visit with my doctor, post-op, and I saw her and I said, let me go show them to you, and I did, because they were high and they were smaller and
High
they
and
were
dry.
perkier.
Yeah.
And she was like, they look great. Of course they didn't, because they were all red and bruised and purple.
And they
You
got
gotta
that
show them
anvil
to
scar.
a woman,
Yeah.
Every man I've ever showed him to is just disappointed.
Oh, I'm sure that's not true.
Just kidding.
That could not be further from the truth.
I'll tell you what.
That's not true.
Stacy
at all.
Deloach, who is has been on this show before, he doesn't like boobs, and so I mean he likes them, but he likes them really small. So he's like, oh no, I would tell her not to do anything. So there you go. So there are guys out there, obviously. Well, you had a baby.
That's where I
with
think you
one.
gotta toe the line, right?
Yeah, there's somebody for everybody.
Yeah.
Even people that with
Potentially.
A
Yes.
cups. even A cup women. No, I'm just being an asshole.
I think I'm between A and B right now. At one time I was a B, but that was like 20 pounds ago. So.
No, I had a girlfriend. Well, anyway, it doesn't. Nobody cares.
We
I had a
digress.
girlfriend
We
that had almost zero boobs, but I loved her, and it didn't matter. It doesn't matter.
It really
doesn't matter.
It really doesn't.
Yeah.
If you care about
if you're sweet and you're smart and you're kind, it really doesn't matter.
Yeah.
It really
Well,
doesn't.
maybe I should get on those things then.
You got to work. You have to work on
Those
the
things are
sweet
cheaper.
Thing. The sweet thing. Yeah.
They really are, and they're less
painful. This is a smart thing
Less
you've
painful.
got.
less
But
physically
harder, though.
painful.
Harder to be nice and sweet.
It is. Yeah.
It is. Yeah.
Yeah, that's true. It's easier to just strut around with big giant tits, and everybody just agrees with you no matter what, just because they want to, be closer to you.
Yeah.
Closer. Well, cool.
Anyway, all right.
Okay,
Well,
thank
good.
you.
Well, thank you. Well, yeah, you're
Thank
welcome.
you for that effort.
We put you in a position that you
great.
were not comfortable with, but what the hell?
Good stuff.
That's what we
right.
do
I mean-
with our guests.
Yeah. A couple of things. You all were going to bring a grotesque story today, and PA Lydia is nodding. And then you had something from your friends at the rescue project. Did you want to talk about that?
Yeah, sure. So, my partner Harvey is really good at ideas, really cool ideas, and I'm good at doing work, right? So we're great partners. He sent you or ordered you something as a token of appreciation for your support of Allied Extract and our humanitarian work. We were originally gonna.
Now, Allied Extract is where you were getting people out of Afghanistan.
Yeah, we formed initially to get people out of Afghanistan. So I think 417 people were taken out of Afghanistan on behalf of U.S. government and CIA requests, Johns Hopkins requests.
Through you guys.
Yeah, through us, and then
And you had all these crazy cell phones that you were communicating with people and all this stuff.
And
It
I'm
was
still getting them out.
it
I'm
was
still
nuts.
chatting with Afghans every day. So I think now we're at 2,500 people.
Wow.
So
Well done.
it's a lot. The U.S. government has relied on volunteers, but now they've taken over, so that's good.
Really?
and
They have?
They have taken over. They're tracking all of the eligible people who can evacuate Afghanistan, and they're managing it. And I have not submitted another person.
Really?
Yep.
Is that right?
And they're still getting out.
Okay.
Yeah.
All right.
So it's great.
Well, all right. Okay, good.
It's a win.
Okay, that is a win.
And so now we've been in Ukraine since the Russian invasion, helping people get out of those frontline eastern areas.
Yeah.
We've got some orphanages we support. We send in medical aid and humanitarian aid. We send stoves to troops, whatever is needed, right? Just aid. Anyway, Dr. Steve was a great supporter of Allied Extract. So Harvey has ordered this
What is this?
for you.
Ooh.
So you can read the top.
Okay, made in Russia, recycled in Am I going to get on a list for this?
I don't think so.
Made in Russia, recycled in Ukraine. Never forgive, never forget. Wow, what is this thing? Oh, what the hell is this?
It's a piece of Russian tank that was blown up in Kyiv during the initial invasion of Russia.
Wow.
Oh my goodness.
And so if you scan the QR code, you can see the tank that this came from.
Are you shitting
That
me?
is crazy.
Oh, okay, now I get it. Oh my goodness.
That's pretty cool, right?
Yeah, it's very unique, that's for sure. Wow.
Yeah. So
Wow.
that's just
Really
north
is
of
cool.
Kyiv during the initial invasion.
So do you
And
guys still need donations? We
tank was
might as
blown
well
up.
plug Harvey's
I
thing.
mean,
That's amazing. Tell him
yes.
Thank you.
Yeah, absolutely. AlliedExtract.org.
Okay.
We were trying to shut down and we just couldn't do it.
Yeah. There's still a need.
There's-
Yeah, there'll always be a
there's
need
just a
to help
need, so,
refugees. so.
yeah.
Okay, well, good for you. AlliedExtract.org, and thank him very much for this. I
Absolutely,
really
yeah.
appreciate
That's
that.
super cool.
That is really
It's pretty
cool.
sweet. Yeah.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings. but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Sergeant and Mr. Smith, you're going to love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last full prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
All right. Good deal. Well, you guys want to take some medical questions?
Sure.
Let's do it.
Right. Okay.
Number one thing, don't take advice from some asshole on the radio.
Okay. Well, this one, I don't know what this is. It just said orgasms, and I figured it was apropos to what we were talking about today. So let's see what this is.
All right. This one might take a few minutes to get this question through, but kind of playing off of the female orgasm and squirting and things such as that.
Okay.
Listening to
This is your buddy who likes the A cups, by the way.
a podcast the other day called Mean Girls.
Okay.
Funny podcast. But anyway, one of the girls was talking about how she's learned that she can have an orgasm from her boyfriend manipulating and playing with her breasts.
Okay.
And then also thinking back that Stephen Hawkins, who's always been confined to a wheelchair most of his life, had a very healthy and
Sure.
fun sex life, according to his wife. So all that being said, the female orgasm, is that physical stimulation or is that more of a mental stimulation? Thank you.
No, that's actually a really
Station!
that's actually a really, really good question. And I have several things to say about this, but you guys can chime in on this. You know, orgasms can be induced without genital stimulation, no question about that. I knew a guy that didn't have any feeling from the waist down, and he could have what he claimed was an orgasm by somebody stroking his arm repeatedly. And orgasms are spinal reflexes. They tend to be in the lower spine, but I guess, you know, the neurologic system is very plastic up to a certain point, and it can reprogram itself. Now, the story I was going to tell about orgasms was the brain dead guy that the wife wanted to have a baby with him before they took him off the ventilator because he was actually deceased. He had no brain activity, no blood flow going to the brain whatsoever. So she manipulated his genitalia, got an erection, and continued to manipulate until he ejaculated. She captured the sperm and or the semen and was going to use it to do a artificial insemination so that she could have a baby with him. Mm-hmm. Now, that just goes to show you even brain dead guys can get an erection and, you know, and complete the transaction. So I think a lot of women probably think most of us are brain dead anyway. But, you know, it's the truth.
It is the truth.
Well, that's because you're an idiot.
But that true story, that can be done because it is a spinal reflex. So what do you guys think about that? But long been known, people experience orgasms during sleep with no stimulation whatsoever or after exercise. But the exercise, women who have it during exercise, we hypothesize that that's because they're jiggling.
Cycling.
Yeah, they're right. Yes, they're jiggling. They're either manipulating their genitalia, you know, with the bicycle seat, or if they do it when they're jogging, because there are women that are trying to jog and they just start having orgasms one after another. That their reproductive organs are just jumping up and down or whatever, you know, and stimulating those nerves. So, what do you guys think? Have you ever had an orgasm in a non-genital stimulation way?
I have.
Yeah?
Mhm.
Yeah, who said that? Tacey?
Tacey.
Let's hear it. Oh, no. Do you not want to?
It's when you listen
just
to the
want to
doctor.
say
No,
that?
it was a long time
You just want to say that it happened?
And it did happen.
Okay,
Yes.
it just did happen. What could you want to say?
From what?
Just kissing.
Really?
Really?
Mm-hmm.
Did
Oh,
it
wow.
feel the same?
Yeah.
Oh my gosh.
Yeah, here's I'm looking at a case report. 33-year-old woman developed the ability to attain and control the duration of subjective orgasmic state without genital stimulation after, Scott, you'll be interested in this, tantric training. Blood was taken at weekly intervals before, during, and after spontaneously induced orgasms that lasted 5 to 10 minutes. Or after 10-minute period of book reading. Okay. Plasma was analyzed looking for luteinizing hormone, follicle-stimulating hormone. These are pituitary hormones. Free testosterone and prolactin, which is also pituitary hormone. The woman also provided subjective scores. So here's the results. Prolactin levels post-orgasm increased by 25% and 48% respectively after the 5 or 10 minute non-genitally stimulated orgasms, or NGSOs, and were still elevated from baseline 30 minutes after orgasm. No changes were observed in FSH or free testosterone. And after, the pattern of all of these things were similar to orgasms induced by clitoral or anal stimulation. Book reading did not result in any change in prolactin, so she wasn't bullshitting, because you could just,
that was the control.
Do like Harry, exactly right. You could do When Harry Met Sally and just pretend to have an orgasm, and how would anybody know? But you can't fake the changes in your pituitary hormones that are released during orgasm. So that's pretty cool. I would have also had them check oxytocin levels.
Mm-hmm.
But anyway, I think that's fascinating.
I'm not sure I would want a 10-minute orgasm.
I mean,
Well, Tacey can tell you about
people
10-minute
have stuff to
orgasms.
do.
She has those all the time, right?
Oh, yeah.
Probably be good exercise.
I wonder how many calories are burned per orgasm.
Not very many. That's an interesting thing, that intercourse is very calorie efficient, and there's a reason for that. When you are a starving hominid that's trying to run away, or one of our ancestors, running away from saber-toothed tigers, and you hardly have any food because you're a forager, maybe you haven't learned to hunt yet as a species, and you need to, and you're trying to have, reproduce in between all these sessions of running away from saber-toothed tigers. You don't want to waste a lot of calories. So it becomes very efficient, even though it seems like, we're sweating and we're doing all this stuff and we're out of breath and all those things after having a prolonged session of sexual congress. It actually doesn't use very many calories at all. Isn't that interesting?
That's pretty wild.
Here you go. Types of orgasms and how to have them. Let's see. What do you mean by types of orgasms? According to longtime sex educator Sierra Dasak, owner of Early to Bed, a pleasure product company in Chicago. So she's not biased.
Not at all.
Because the anatomical structures that can lead to orgasm are often intertwined and hard to distinguish, someone might have an orgasm from stimulating the front wall of the vagina, a.k.a. the G-spot. Well, now she's just making up stuff. Or have an orgasm from stimulating the external portion of their clitoris. But ultimately, these orgasms all come from the same place. Well, there's no science here.
Lady, come on.
She's just selling toys and saying things. But anyway, all right.
Okay. Well, that's impressive. Kissing. Some kiss.
Yeah.
Well, yeah. It's a long time ago.
Yeah.
Yep.
I've never had that.
Twerk with me, I'll tell you that. Nope. My best sessions with Tacey were with her alter ego named Tacinda.
Tacinda comes out after about 7 glasses of wine.
Yes, and Tacey, and I, I'm getting it on with Tacinda, and all over the place, on the couch, and then on the floor, and then on top of the couch, and then all this stuff.
Don't remember it.
And then the next day, and I'm like, damn, I did pretty damn good. And the next day, she's got no recollection of it whatsoever.
Why are my panties on the floor?
Yeah, that's exactly what. That's how I knew.
God.
That's how I knew. She wakes up and she goes, "Why are my panties on the floor?" And I'm like, "God damn it!"
I was so good.
Oh yeah, but all I can do is just tell her, oh yeah, I was awesome. Okay, sure. Why wouldn't you say that?
Yeah. Tacinda.
Tacinda.
It's like Tawanda from Fried Green Tomatoes, only the sexualized version.
Yeah. Well, Tacey has a
alter
friend
ego.
who's been on the show before, and when she
Drunk
drinks,
Tacey.
when she drinks, her alter ego is, well, her name is Wendy, and her alter ego is foreign language Wendy, because she you can't understand the things she says. So she's fun. She's fun. Okay. Let me see. This one says how to pay for stuff, and then we're going to get to your gross questions.
Hey, Dr. Steve. This is Brad. I'm the guy who fell 23 feet. Called a few months back. Drove myself to the hospital.
Huh?
I was just wondering
Fell
about
23
pain.
feet.
I always think about pain a lot, especially since I'm sober. Never gotten the painkillers, but just drinking. But I was wondering, I know you probably answered this before on one of your podcasts, but if people feel pain differently.
Yeah.
Like,
true.
I feel like I have an extremely high tolerance for pain, but I also feel like as a blue-collar guy, I've lived most of my life with it, and it just becomes normal. And
Yes. Now, this is a real good point.
Very true. Yeah.
I mean, I live with pain every day. It doesn't affect my quality of life. Every once in a while, maybe, but really not to any great extent. I still do all the things I'd like to do. And yeah, you know what? Because my back is so effed up, I don't have to jog anymore.
Exactly.
So it's actually a plus in that regard. But I know people, and the thing is, if I could feel their pain, then it would be my pain, right? It wouldn't be their pain anymore. So this is a philosophical question that has been bandied about by philosophers for ages about pain. But I have seen people whose backs aren't as effed up as mine who are completely disabled.
Yes.
Now, is it because their syndrome is different, or do they just have a different tolerance for pain than I do? So that's kind of what he's getting at. So let's see where he goes with this.
just need higher and higher amounts of pain before you start feeling something.
Yeah.
This could go for emotional abuse also.
Yes, I agree.
Yeah, I was just wondering if you just get more and more accustomed to pain.
Well, Scott can talk about this.
Oh, yeah.
Yeah. We could talk a little bit about depleting substance P and stuff like that, and we'll get to that. But go ahead, Scott. You're the pain expert.
Pain guy. Yeah, I don't even know where to start with this question. So I would say yes.
Well,
certainly, the more pain you've had in your life, typically the better you tolerate pain. And when we start looking at people backs like your backs, as you said, sometimes we'll look at images of a lower back. It just looks awful.
Yeah.
I mean, just a train wreck.
Right.
And you look at this person, you say, how in the world are you even walking? Much less kind of being normal, normal bladder function, normal bowel functions, etc. And then we'll see, someone who you look at an image and it's like,
there's nothing there.
There's nothing there, and they're just miserable. And there's so many factors. History is one. You've seen the reports where redheaded people tend to have less pain tolerance. Have you
Oh, really?
Yeah,
I have seen that.
Oh, I thought it was more.
No, less. Much lower levels of pain. And then the other thing, Dr. Steve, is our long-term use of opiates.
Yeah.
And sometimes when people have, and one of the things I hate to see in my office is someone who's been on heavy doses of opiates for years. They tend to develop this thing called hyperalgesia.
Yes.
So they have a much greater reaction to pain than what we would think would be normal.
So hyperalgesia is an increased sensitivity to feeling pain, and then you have an extreme response to pain.
Yep.
And that can actually be caused by pain medication.
Yes,
too.
it-
There
yeah,
is a thing
absolutely,
called opioid-induced
Hyperalgesia,
hyperalgesia, where the more stuff that you put people on, the worse that their response to pain is. And I'm going to give Dr. Scott a bell.
Give yourself a bill.
Research has shown that people with red hair perceive pain differently than others. They may be more sensitive to certain types of pain and require higher doses of some pain-killing medications. Now, however, I'm going to give PA Lydia a bell, too.
Give yourself a bill.
Studies suggest that their general pain tolerance may be higher, so you were both right.
Ha!
So there you go.
High five.
Way to go, sis.
As a ginger.
Yes, as a
Yeah.
I do
So
notice.
do you notice that?
Oh, absolutely.
So tell
My friend and I talk about like what is pain? Like what is even pain that
Yeah.
people get? Yeah. I like cracked some ribs one time and it was quite painful, but like the question is like when do you take pain medicine?
Right.
Right. So I
Yep,
could
right.
tolerate it. On the flip side, I was having an emergency C-section and they kept giving me anesthesia, like to block it. And I just kept telling them I could feel everything.
Wow.
So they ended up having to intubate me.
Really?
Because they could
And put you
not
under
get
general.
it. Yeah, they put me under general because they could not. They like cut through, and I'm like, I can feel it. And then they go into the
man.
muscle. I'm like, then I start screaming, and I will
Oh,
give.
you were screaming?
I will give the ex a bill because I remember him saying she's really quite stoic. Like she's not a screamer. She's really quite stoic.
Yeah.
So then they
In
put
other
me
words, if
under
she's-
general. Yeah, I could
Yeah,
feel it.
really hurt
Yeah,
you.
so definitely we require more in it, like, if you're going to do sutures, something like that, more lidocaine
Right.
or.
Interesting.
Yeah, that's kind of
And I've seen that in practice for sure.
Yeah. Yeah, I know. Pain is such a complicated thing. And, I'm like you, Dr. Steve. I tell people, whatever you do, just don't compare your pain to anybody else's.
Right.
It's yours.
Exactly.
And
That's
if
important, yeah.
if you say it hurts, then it does hurt.
Yeah.
And let's try to figure out what we can do to make it not so awful.
Yeah. And pain really is just the body's system of alerting the brain that there's something wrong.
Right.
And part of the problem is that there is neuropathic pain too, where it's pain of damaged nerves. And PA Lydia induces this in people every day with chemotherapy and stuff. And diabetics have it as well. And that's a non-functional pain because that pain is just telling the body that the nerves are damaged. It's not really
Yes, they'll say move your hand away from the fire.
That's right. Because nociceptive pain is a normal, pain that keeps you from putting your hand, when you're little, putting your hand on the stove twice.
Exactly.
You might do it once, but you won't do it twice. That's nociceptive pain.
Right.
And then, of course, there's visceral pain. That's just pain from organ
pain.
stuff, and which really, before we developed surgery. What was the purpose of that other than to tell you you're going to die?
Exactly,
Bye bye.
Yeah. It's kind of sucks.
Yeah,
but anyway.
like, isn't that the truth? It's like you think back in time, you think, God, living with, like an acute appendicitis, how long were you going to live?
Well, some people did probably live.
And they probably did, yeah.
But there was... That's one of the advances in modern medicine that's really made a difference. The biggest leap in lifespan was sanitation.
Right.
And separating our stool from our drinking water. And when we did that, then we went from living 35 years to, whatever. And then it's been incremental since then. And a lot of the stuff we do in modern medicine is lifestyle stuff. So when you get an appendicitis, you can go in and take your appendix out and you don't die a horrible, painful death anymore.
It may add real quick to this pain story because I love talking about pain. But years ago, we went to see in New York City, in Manhattan, in the museum there, they had a photo tribute to the Civil War. So all these pictures in the Civil War, and they had all these soldiers standing there, and like, one would be standing there on a crutch, and his leg's been cut off, and then they've got another one, biting on a belt, and they're sawing his leg off, and actually pictures of this.
Yeah,
it's like, God.
I have people come in. I say, "What's your pain today?" And they'll say, "Oh, it's a 10." And I say, "Okay, let's recalibrate this a little bit."
You seem rather calm.
Yeah, right. Yeah, a 10 is you're in the Civil War. You got hit by,
exactly.
You got hit by a musket, and I am now sawing your leg off without anesthesia with a rusty saw. That's a 10.
And they're pouring alcohol in it to clean it.
Oh, and then
sterilize it.
You have all the pain.
And then cauterize it.
My
God.
That's a 10. So on a scale of 1 to 10, with that being a 10, what are you? About a 4.
Yeah, exactly.
So it just, you got to get the scale calibrated. That's all.
Yeah.
Do you calibrate the scale? I don't bother calibrating the scale with people.
I do for that kind of thing. When I've got somebody who walks in and sits down and says, my pain's a 10. And I want us to be on the same page. So that if I write a 10 down and someone comes in later and goes, well, this person's a 10, and they didn't, they gave them Lortab 5s or something, that seems pretty heartless. But if you recalibrate it, with that being a 10 so that we all agree that's a 10, then it just makes it a little bit easier for us to compare what we're doing with each other.
I think that's wise.
The notes in the chart are really for the next person to read, but or the attorney, unfortunately. Let's talk a little bit about extinction of pain, though. Substance P. You want to talk about it a little bit? You deal with substance P, right?
Yes.
Or am I putting you on the spot?
Well, a little bit on the spot. But so with the acupuncture, we work on both the peripheral and the central nervous system as far as pain control.
Yeah.
So you've got peripheral nerves that are stimulated, and typically, if you're going to take an oral medication, an Advil, Tylenol, aspirins, those things help with the peripheral nervous system and affecting the substance P and how that's transmitted, right? But the electric acupuncture actually stimulates the endogenous opioids in the brain, the mu-opioid stimulating hormones.
Right. So they're like opioids, right? You said that.
Similar, yeah. So, one of the things I love about what I do is speaking specifically for, nerve pain, radiculopathies, we call them. Let's say somebody's got a really bad shingles pain.
Yeah.
Okay. So, which is a really good example, or a discogenic pain. So a disc is maybe pinched.
Yeah.
What we actually can do is by putting the acupuncture needles and the electrical stimulation to that, we actually stimulate more of this substance, and flood the spinal cord so that all of this pain is dampened greatly, if not sometimes
just
turned off.
Yeah. Re-regulates.
Yeah.
So substance P is this neurotransmitter that's thought to transmit pain signals.
Right.
You can deplete substance P, like in people who have shingles and they have what's called post-herpetic neuralgia, where you've got pain that persists even after the shingles are gone. And it's just because those peripheral nerves are being stimulated. You can put capsaicin cream on there. That's cream that actually has the stuff that makes red peppers hot. And when you rub it on the skin the first couple of times, it'll burn, obviously, because it's like rubbing jalapenos on your skin. And then if you keep doing it, it will deplete that substance, substance P, this neurotransmitter, because you've used it all up. And now you can't transmit pain signals anymore, and then it makes the pain go away. So you have to keep that stuff on there. The interesting thing is that substance P, which is this neurotransmitter, also is involved in inflammation, but also in mood and anxiety and learning. So if you've got someone that has horrible pain, this may affect their mood and their anxiety level, and so you get this whole syndrome that we call chronic pain syndrome.
Blood pressure.
Yeah. So anyway, it's just kind of interesting. So people who say, that person's anxious and they've got chronic pain, and there may be a reason for that. They're being flooded with this substance P stuff. So it's just one hypothesis, but very interesting. You got any questions? Oh, wait. Well, let's do our gross stories because we're actually running out of time. So who wants to go first on this? We're not actually competing today. So
I've got a couple questions. I did not bring a story.
Okay. There you go. Okay.
I can go. You want to do the questions?
Tacey, did you bring your gross
I have
story?
an interesting psychological disorder.
Okay. Ooh, I like it.
Well,
Yeah, go ahead.
Go ahead, yeah.
Oh, you mean, you were just talking about yourself. Yes. It's,
that's
what she said.
That too. It's called the Jerusalem syndrome.
I've heard of this.
And it occurs when a visit to the Holy Land triggers obsessive ideas about religion.
Really?
And even messianic delusions. The condition can affect anyone, regardless of religion. Symptoms may include compulsive cleaning and grooming, wearing white robes, and sermonizing.
Holy moly.
Sufferers without a pre-existing psychiatric condition typically return to normal within 5 to 7 business days. Or it doesn't say business days, sorry. That's the old worker in me.
I love it.
And they feel some shame about their behavior.
Wow. I've got a psychiatric journal. Acute psychotic state observed in tourists and pilgrims who visit Jerusalem.
Isn't that crazy?
What if you live there? The main symptom of this disorder is identification with a character from the Bible, exhibiting behaviors which seem to be typical for this character. 3 main categories of the syndrome were identified with special focus on the category unconjoined to previous psychopathology, the pure form of the Jerusalem syndrome, and and so they just give the diagnosis.
I like how they're
criteria, but that's
embarrassed
something.
after.
Yeah,
that was why
that there's
I picked
shame afterwards. So wow,
Become psychotic after arriving in Jerusalem.
I bet they see this all the time. And people get off the plane and they get in their hotel room and then they start acting crazy and the people in the hotel are like, well, we got another one. Another Jerusalem syndrome. Isn't that something? All right, very good. Okay, well, we can't just go, wow, and just sit here and read.
Yeah.
We have to actually put on a show. So,
I'm just imagining. To be fair, you didn't say grotesque in the prompt. You said bring a fucked
That's
up.
exactly right.
I said
You said bring a
story.
fucked
Yeah,
up
okay,
story,
that's right. You're right.
So that changed me a little bit.
Okay,
So
yeah.
I got a couple.
Okay.
They're quickies.
Yeah, that's fine.
I didn't delve into a lot. So number 1 repeats the theme. So there was a 2006 case. Essentially, what I did was look at the worst malpractice cases in history for this. So there was a 2006 case where the anesthesiologist administered during surgery the paralytic, but forgot to give the patient the true anesthetics and the medications that help induce amnesia so that you don't remember the
Oh, no.
procedure. So the patient
they paralyzed him?
They paralyzed the patient
But they
and
were awake.
operated on him. They were awake. So about 20 minutes into the surgery, they realized this guy's awake.
What?
It's awful. So he was feeling all of the pain, but he couldn't move. He couldn't shout.
Right, yeah.
He
So
couldn't. And I've heard of this happening.
there
That's
are
the
these
worst
medications.
nightmare for people.
They're just called
That's
paralytics,
fucked up.
and what they do is they just shut off your ability to move. And when you do that, you can't give somebody one of those unless they have ventilatory support because they will die. They can't breathe, they can't move, they can't do anything, but they are absolutely awake unless you don't ventilate them, and then they'll faint and then eventually stop breathing and die. So that is a nightmare.
Don't they
Kinda
do
messed
that when they do the gas or the death row for the inmates thing?
No, I don't know.
They use that.
They use potassium, I think. They
paralytic
give them,
first.
They give them propofol and then they give them potassium. Maybe they do paralyze
There's a
them
couple
too. I
of
don't know.
different things that go in there.
Yeah, I was gonna say it's a,
I mean,
it's a nice
according
cocktail.
to
So this particular case, the patient committed suicide a couple weeks after.
Yeah, I'm sure it was so traumatic.
Yeah, extremely traumatic.
Because
So
you just think your life is one way, and then all of a sudden you're just being.
operated on.
Holy moly, that's awful.
That's some Civil War shit.
Yeah, well, I wonder if that had to be traumatic for them too. I mean, having your leg sawed off just while other people are just crowding around watching it. I mean, that would just have to be disastrous.
Awful.
Anyway, you have some questions from the waiting room, right,
couple.
Dr. Scott? Let's do those, and then Lydia, save yours. You're going to come back next week?
I could, yeah.
Yeah?
think
Can
I
you just
can.
come back every week?
Not every week. So here's the thing: like, I don't have a babysitter, right?
Okay.
So every other week, like
How old's your kid?
she's 2.
She's old enough.
Benadryl,
I know. I've just never had a
vodka.
babysitter. So it's like
Should be
my
fine.
mother, who's a bit passive aggressive and doesn't like to babysit unless I'm working
Bring her here.
in clinic.
Bring her here, and Tacey will watch her one time, or Beck will, or something. Yeah.
No, I really should get she needs to have other
Yes.
like outside people. I've just sheltered her quite a bit.
Okay, well, we
So,
can talk
yeah.
about that because
We'll figure it out.
We might be able to help you in that regard. All right.
Okay, yeah.
Okay, so
Next
either
week.
next week or the week after.
Yeah, next week is good.
All right. So what have we got, Dr. Scott?
Yeah, so Bob Dandy was asking about the difference between a DO and an MD, and he's got some chronic lower back pain.
Okay.
And I was wondering our thoughts.
Yeah. Okay. DOs and MDs. So DO is Doctor of Osteopathic Medicine, and then MD is medical doctor. And then you have MBBS. Those are people who come from certain other countries, and that's just what they're thinking. And I can't remember. It's Master of Biology. I can't remember what MBBS stands for, but it's the same thing as MD. Let's look it up real quick. MBBS. It is Bachelor of Medicine, Bachelor of Surgery. Okay. And it's the same.
Okay.
And when they come here, once they get licensed, they'll just get to call them MD. They'll change it to MD because nobody knows what the hell an MBBS is in this country. So now the curriculum is exactly the same. There are some parts of the country where mostly what they have is DOs. When I was a kid in Michigan, my pediatrician, the family general internist, the person who delivered me, they were all DOs. And then in other parts of the country, like the South, here, there was a while before they accepted doctors of osteopathic medicine. And that was unfortunate. It was just some, I don't know how things are.
There weren't a lot of schools here for it.
Right.
Now there are.
And when people we had an OBGYN come, and he was a DO. He was the first DO OBGYN that got privileges here. I was here when that happened in 1980-something. Everybody loved him. And once they realized, well, okay, they're just the same, then and it actually opens up your pool of people you can hire if you will also hire DOs and MDs. Now, these days, I'd be interested in talking to any DOs that have had any discriminatory practices against them when it comes to getting hospital privileges, but I'm not aware of any anymore. So, but the thing about the DOs is they have another part of their curriculum that MDs don't have, and that is osteopathic manipulation. Right. So they do, muscle energy stuff, and they do manipulation. It's not like it's different than chiropractic medicine. As a matter of fact, the person who invented osteopathic medicine,
A.T. Still.
Well, there you go.
Andrew Taylor Still.
Ain't you something?
Give yourself a bill.
He had this method where he would put people's, like if you had a hip pain, he would get you on the table and he would manipulate you around until he found a position where the pain went away. And then he'd just hold you there. And we had some sort of connection in that regard, going way back, Dr. Scott. But anyway, it's a really fascinating thing. I have absolutely no issue if you go to a doctor of osteopathic medicine and do some of the things that they do. Now, I will tell you, a lot of osteopaths, when they get out of osteopathic school, they don't do it anymore. They don't do it anymore.
I was married to one.
No.
So we were married during all of DO school.
Oh, is that right?
Yeah. And
I didn't realize he was
He would have a lot of females in his apartment practicing OMM.
Yeah. Ooh, let's do the.
I was married to one too.
Well, and so one of the
vigorous chest massage.
Yeah, actually, though, so I was able to learn quite a bit from him, and it does work, like muscle energy techniques, things like that. I mean, it's quite different from chiropractic.
Yes, very, very different.
But certainly, like you said, Dr. Steve, like the curriculum is the same. The boards are essentially the same.
Yep.
He took like the main internal medicine boards.
I'm getting ready to start a fellowship at a DO through a DO medical school or, osteopathic school, and they actually want an MD to be the program director so that they can get MDs and DOs in the program. So they're all together. The programs here have DOs and MD, graduates. It's totally fine. But if you can find one that'll do manipulation, if they like doing it, that's the ones.
That's exactly. And thank you for saying it, because
we have a friend who actually.
Yeah, I was going to add to that. So for old Bob Dandy there, the MDs and DOs, as long as they know what they're doing, they're going to be great.
Right.
The one benefit, and many MDs, like Dr. Steve, can actually do some of those really gentle manipulations.
Yeah, because I trained with DOs.
Yeah. So just make sure either way you go, just find somebody that knows what the hell they're doing.
And they like to do it.
And they like to do it, right.
That OB, he, a lot of women have low back pain when they're pregnant. Mm-hmm. And it's not only because of the weight, but because there's a hormone called relaxin that's changing the way that the muscles and the ligaments
ripping their backside apart.
Yeah, right. Yeah, it does that. And he could do manipulation on their back that the MDs didn't know how to do. The MDs just give them medicine or tell them deal with it. And he could get them up on there and flip them around and put his fist under their back and then twist them a certain way and get their pain better. So, there were things that he could do that other people couldn't do. So, it just really depends on the provider, but they do have that in their curriculum that's beyond what MDs get. So it's pretty cool.
Yeah.
Yeah.
And I've got one other quick question for you, Dr. Stephen. You're the expert on this. So we've got, and I was trying to see who, Doug. Doug, unfortunately, has a pup that's got a big Chalazion.
Oh, my God.
So, unfortunately, he was just asking your thoughts about that.
Yeah, okay. Well, it's just a bump on your eyelid, basically. These things can also be called meibomian cysts, and I've had them. And as a matter of fact, if you go to our YouTube channel, the one viral video that I've got is Dr. Steve gets a Chalazion removed. It had like 300,000 views. And then YouTube told me, well, you can't monetize this because it's a surgical procedure. But anyway, you can go look at it. And very often these oil glands become blocked in the eyelid, and it'll cause a sty. And then when the sty resolves, it will leave behind this little mass of fibrous tissue called a Chalazion. And the way that they remove it is crazy. It sounds totally nuts, but you don't want to take it out from the eyelid side, the skin side, because if you do, you'll end up with a scar there.
Right.
So what they do is they flip your eyelid, they invert it. Mm-hmm. And then they'll stick a needle in it where the Chalazion is and fill it up with numbing medicine.
Fluid.
And then, yes, well, it already has, it kind of has this, it's not even fluid, it's kind of just a fibrous
like a granulated
mass. Yeah, kind of, yeah. But yes, they'll inject fluid, pain medicine in there to numb it up. And then they will cut a slit in the eyelid, but you want to do it from the top of the eyelid to the lash part. You don't want to go sideways because that'll really screw it up. But the fibrous structure of that is in that direction. So you just cut along the grain and you open it up and just take a curette and scoop that sucker out of there. And you don't do anything else. You put some antibiotic ointment on there and just go about your business. And when it wears off, it hurts a little bit. It's not that bad.
Oh, good.
And the thing with me was when I used to get these Chalazions all the time, they would be so big that they would distort my vision because they would change the shape of my eyeball in a very subtle way, but it was enough to mess my vision up. So I would want to get, and they look stupid too. You got a big lumpy eyelid.
So surely they can help that puppy.
Yes, absolutely. Now, a puppy isn't going to let you just sit there and stick a needle in their eyelid. So they'll have to put them to sleep. Yeah, they'll have to put them to sleep. Or I'm sorry, not put them to sleep.
Oh,
that has a different connotation with dogs. They'll have to give them general anesthesia.
Yeah.
Now, I'm going to tell you, I had the most enraging story that has to do with having a Chalazion removed, not with that doctor, but his partner. Mm-hmm. And I rotated with this guy. He knew me. And, I've known him for years. I went to him. I had a Chalazion, needed to get it removed. And it turned out that this guy just liked doing cataracts, so he didn't like doing all this kind of bullshit, right, in the office. So, but he comes in and he says, okay, let's do it. And, when someone flips your eyelid and sticks a needle in your eyelid, you're going to grip the...
Yeah,
you're
gonna have something.
You're going to white knuckle it a little bit, right? Yeah. Well, I had a book I had ghost-written an archery book with a friend of mine.
Cool.
And he was 10-time indoor national champion. I ghost-wrote this book, published it, but I had the brand new books, and so I was flipping through it to proofread it to make sure they were okay before we sold it. So I had it in my lap, right? And he sticks this thing in my eye, and now he starts talking to me like I am 5 years old, maybe not even 5, maybe 3.5. And he's like, oh, are you the big archer? Yes, you are. Oh, you're the big archer, aren't you? And I'm
That
like,
is so
will you
creepy.
shut the fuck up? Dude, that was so weird.
What the hell?
I guess he saw me sort of white knuckling, but it's like, dude, just do it and shut up and don't talk to me.
Are you the big? Is that what you say in the bedroom?
That's what I
big
said.
archer.
I'm gonna start.
That's what she says when we're strutting our stuff. Yeah.
Big archer.
Are you the big archer? Yes. Give it to me, big archer.
That ended really quick.
Yeah. Yeah. Oh, your arrow is so big.
Good stuff.
All right. Got anything else?
I'd say let's wrap it up.
Ugh.
Wrap
All
it
right.
up.
Well, thanks always go to Dr. Scott. Thanks, Tacey. Thank you,
you.
PA Lydia. Always a
Thank
delight.
you guys.
Thanks to everyone at Sirius. Thank you for allowing us to go on your breast journey. Yes. With
Odyssey.
With your Odyssey, right? Breast Odyssey. Ooh, I like it. There's another word that's coming into my head, and I'll think of it before next time. Thanks to everyone at SiriusXM who steadfast supported this show. I've been doing this 17 years. When we start talking about boobs, I still get all tongue-tied and, weird. Lewis Johnson, Jim McClure, I'll just shut up now. Sam Roberts, Jim Norton, Travis Tepp, Troy Hinson, Paul Charsky, and Roland Campos. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for podcasts, schedules, and other crap, and listen to our podcast at riotcast.com or wherever podcasts are found. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye, everyone.
Bye.
See you guys.